Welcome to OLLI at SBU. This is our lecture series, and today we have Dr. Nicole Absar. She is with Stony Brook Medicine Department of Neurology and Psychiatry. She's a clinical assistant professor. She provides evaluations and management services for Alzheimer's disease, Parkinson's, other dementias, geriatric mood and anxiety disorders. She has a passion for integrative neuroscience, interfacing neurology, psychiatry, and cognitive health and dementia care. She is also a registered yoga teacher, and she specializes in yoga as therapy for dementia and neuropsychiatric illnesses. So she is well-rounded, and I want to welcome her to our OLLI lecture series. Nicole?
Thank you so much. Can you hear me okay? Okay. Thank you so much. It's been an honor, and thank you for inviting me. So we have an interesting topic today. So because of the time, I have so much to share. So I would request that if you guys have any question, anyone has any questions or anything, to wait until the end of the presentation so I can finish up and then we can discuss. Okay, so let me share my screen. So just make sure everybody can see my screen. Can you see my screen?
Yeah, but we're seeing that extra slide.
Yeah, so I'm going to start. You're still seeing an extra?
Yeah, click on display settings.
Okay. Oops, sorry.
In the middle. Oh, now we have your desktop.
All right, so
there we go. Perfect.
Is it perfect? Okay,
yes.
Thank you. Okay, so
Dr. Absar, it's still showing that extra slide. I don't know what you did.
I know, I thought I did that.
There we go.
Is it better?
Yeah, leave it like that.
Okay, I'm not gonna touch. All right, so the topic, basically we're gonna talk about a perspective of cognitive health, like a brain health. So the healthy brain and our aging process, and what can we do to have as much as possible good quality of aging and quality of life without significant decline in our cognitive health. So that's basically the topic to be discussed. How can our brain be healthy? So I have to I have no financial or any disclosure, but I do have to explain to you that some of the presentation materials and some of the scope of this presentation, beyond being a neurology and psychiatry attending, because I'm, as you heard, I'm a yoga teacher. So some of my presentation may come from my other hat, which is non-neurology and non-psychiatric health, non-medical health, which is I'm a 200-hour yoga teacher. And I'm also what they call YACEP, which is a National Yoga Alliance certified education provider for healthcare professionals. So I provide healthcare professionals different type of brain disorders and yoga therapy presentation. So that's why I may add some of the presentation beyond my physician hat. Okay, thank you. So we're gonna first talk about aging. We all are getting older. Nobody is getting younger, which we were, but no, we are all getting older. So how can we make sure we have a healthy aging? How can we make sure that what is the underlying, what is the border between the healthy aging and dementia? So we're going to talk a lot about when the healthy aging becoming dementia and what can we do to keep the healthy aging as long as possible so we can maximize what we have without declining our cognitive health. So as we get older, we have this normal healthy aging. As a result of that, we have some brain changes happen. even though we do not have any changes in our cognitive state, meaning we're functioning fine, everything is okay, but our brain is actually already changing. And one of the major change is an abnormal protein accumulation. I'm going to come back to this slide quite a few times, so I'm going to just show you what I'm talking about. This is what I'm talking about. As we get older, normally we all have two of this protein. One is called amyloid and one is called tau. Amyloid is a normal healthy protein in our brain that help our brain neurons, So normally when it gets toxic, we have a system in our brain called cerebrospinal fluid, which is our water, like excretion, like a drainage system that brings the toxins through the blood to the kidney. So you go to the bathroom, you pass it through the urine, everything comes out, all the toxin get cleared. So this is how we actually survive, even though we have this amyloid and tau, because these are water soluble. So water in the brain called cerebrospinal fluid can get them out. For some reason, we don't know exactly what. We think some may be genetic, some may be some kind of mutation. Some genetic mutation make this protein, the amyloid and tau protein, somehow alteration in their shape and structure. What I meant about that is, these are molecules, so they have certain conformation in the molecular architecture. So because of some genetic mutation, this molecular change happened. And that changed the solubility of this molecule to the water, meaning they can't be soluble in the water in the brain anymore. They get trapped in the brain because brain fluid cannot dissolve them to get them out of the brain, to get them out through the drainage system. And sometimes, what happens is they get kind of accumulate together. When the amyloid accumulate together, it makes these plugs of amyloid called A beta plug, as you can see on the slide, meaning amyloid, they have four, I'm not going to go details, but they have different chains of amyloid, like alpha chain, beta chain, gamma chain. This is the alpha, this is the beta amyloid. So A beta plugs, this is the toxic protein that I'm talking about. That gets accumulated and that replaces the normal healthy looking brain. Eventually the entire brain becomes an amyloid plug. So that is what the onset of Alzheimer's disease. That is how the Alzheimer's disease starts. Then there is a second protein, as I was talking, called tau protein, which is also normal for our brain, because the tau protein helps our brain connective tissue to transmit information from between the brain areas. So this is really good for our brain. This is how they talk to each other. So it is a normal element. However, because of certain things happen in the brain, as I was saying, maybe genetic, maybe mutation, something happened, this tau protein also go into some conformational changes in the molecule. One of the biggest change happen in the tau is addition of a chemical called phosphorylation, meaning addition of phosphorus that makes this tau protein called hyperphosphorylated tau, meaning it's not anymore that normal form of tau. And that is an abnormal tau that accumulate like amyloid and makes a tangle of tau. And that's what you see, the tau tangle on this slide. And this amyloid caused the disease of Alzheimer's, but the tau tangle is the reason that Alzheimer's disease decline or progress or cognitive status decline every day. So one protein is the cause of the disease, one protein is the progression of the disease. So both of them together, we call it Alzheimer's disease. So this is the molecular mechanism of Alzheimer's disease. What we find out that even though when we are aging normally, when we do not have any cognitive symptom, this brain changes is actually already happening. We now know that it takes at least 15 years, sometimes up to 20 years or even longer for any symptom to appear after these brain changes happen. Meaning scary, yeah? Meaning that we think Alzheimer's is an old age disease, but it's actually not, because you can think about this protein takes 20 years to develop symptoms. Meaning when you have symptoms in your 60s or 50s or 70s, minus that 20 years, meaning your protein must be accumulated at least 15 to 20 years before onset of your symptom. So you may be in your 50s, but your disease must have started in your late 20s or 30s. So this is why we have difficulty finding the cure of this disease, because when we find the cure, when we take the sample of patient for this kind of research study, it's too late, because we catch the patient when they started having symptoms. But think about, they already have the disease 20 years ago. So we got to find people when they're still normal. They're walking around in the street. They have no idea they have Alzheimer's disease in their brain, but they're just walking around. They have no idea. They're driving, they're working, they have children to take care of. They have no symptom. They're fine. So this is the frustration in the medical community, in the neurology community, that we need some days, we need to find the cure, of course, but we need to find the diagnosis in the early 20s and 30s, or even late 30s, wherever, so that we don't have to wait for another 20 years to start having symptoms. We can start the medication at that time, and then Alzheimer's disease will be a history. So this is our dream. This is all we are working on, like the way that we do mammogram, like the way that we do colonoscopy. Same way, you can go to a primary care doctor's wellness visit office in your 30s or early 40s, just for checkup. And if you have a genetic history of Alzheimer's disease in your family, and you can tell them that, I'm afraid I have a family history, like the way you tell that you have a family history of stroke or heart disease, and they check your cholesterol and everything. So similarly, if you say to them that I have a family history of Alzheimer's disease, maybe you should check me out. Maybe at that point, doctors can order scan that is also available now. It's called amyloid PET scan, meaning this is a PET scan that pretty much define or pretty much look for amyloid beta plaques, these plaques in the brain when you're still alive. Because remember, this slide is a pathological slide. This is a biopsy slide, meaning you can't do brain biopsy. So we can only do brain biopsy when you die, meaning after autopsy is done. So this slide is a definitive diagnosis of Alzheimer's, but it's useless because you're already dead. Because what is the purpose of diagnosing? But the amyloid PET scan is very close to this, which can actually show you amyloid in the brain when you're still alive. Unfortunately, this scan is not yet Medicare reimbursable for commercial use. It is available everywhere, including in our Stony Brook. It's a little pricey. It's about $7,000 to $8,000. The price will come down, very significantly, especially with the new disease treatment that we are discussing soon. That when the FDA come up with that protocol for the new treatment of Alzheimer's, then you have to have an amyloid PET scan done. So Medicare will pay for this huge money for each patient at that point, because then it would be worthy to pay for that much money, because you'll have a cure, you'll have a treatment to some extent to try the disease modification therapy. But as of now, we don't have it available for kind of commercial purpose. So hopefully in the future, in the wellness visit, that primary care doctor can use those scans. And then if you have a positive amyloid PET scan, and if you have the treatment available by then you can start the treatment. So the whole disease will be just like a history. So coming back to the previous slide, this is all asymptomatic stage, meaning you have a healthy aging process going on. First one, you have no brain pathology. There is no amyloid, there is no tau yet. And of course, there is no symptom, no clinical symptom. That can goes on for several years. Then the slide that I show you start having this pathological diagnosis of Alzheimer's disease, meaning you still have no symptom, you're still functioning fine, but now you have the positive brain pathology, meaning now you have amyloid in the brain, you have tau in the brain. At this stage, as I was discussing, the only way you can diagnose this disease is by doing a brain scan called amyloid PET scan, which is still not available for commercial use. You can also do a CSF, cerebrospinal fluid, which is a lumbar puncture, and look for this amyloid and tau in the cerebrospinal fluid. But remember, you're still asymptomatic because you have no symptom, and that stage can continue for 15 to 20 years. So there is no symptom, you have no idea that your brain is already changed. After those 20 years or 15 to 20 years of time, you started having this subjective cognitive decline, meaning you still have only subjective symptom. Meaning what? Meaning if you are living with the family, you think that you are not, doing the way you used to do, meaning your memory is not as sharp, or your functioning is not as sharp, or your driving ability is not sharp, or some of the cognitive function is not like the way it used to be, and you complain about it. But objectively, your family doesn't see that. Nobody see that. And objectively, they will say, no, I don't see anything. You're just anxious. You're just, maybe midlife crisis or something. But nobody pay attention to that. So this is a stage called subjective cognitive decline, meaning subjectively you do recognize some changes, but it doesn't show up in your functioning. It doesn't show up by anybody yet. And obviously, when you come for us at this stage for any kind of cognitive testing, you're still fine. You don't see any problem. But if you still do the brain pathology, meaning all those scan, that would be positive because your brain already started 20 years ago. That changes already happened. This subjective cognitive decline can also go on for several years. Then the next step starts, which is a mild cognitive impairment, or MCI. What is MCI? MCI basically, it's almost like a pre-dementia. So it's almost like borderline between the normal aging and dementia, meaning you now, not only objectively, now you also have subjectively and objectively both cognitive symptoms, meaning your family also can see some decline. Your family can agree with you that, yes, what you recognize that you're not like the way you used to be. We also feel that there are some changes. It's not major changes. You can still function fine. It's just minor or mild changes is happening. And when you come to test for us, when you come to see me or someone like me, you still show, you can now show some changes, but very mild cognitive changes in your testing result. And this is the bottom line. Your ADLs, meaning activities of daily living skills, and your physical and mental functioning is still functioning fine. There is no changes in your grooming, or you can still take a shower by yourself. You can still take a bath by yourself. You can still drive. You can still manage your money. You can still do everything that we call activities of daily living skills or instrumental activities of daily living skills. Those are still fairly intact. And that is the marker between the border of MCI and dementia. When you lose the activities of daily living skills, then you cross the border to dementia. So before the dementia, what change, what is the marker? What is the border? What is demarcation between the MCI and dementia? In a very layman's term, activities of daily living skills, meaning you can still do everything by yourself. You can still shower. When you lose either of those, like somebody took care of your money, somebody concerned about you driving because you are too close to the car, you have some problem with the visual depth perception that you are not seeing the car properly in alignment, like you are too close to the curb of the road, or you are not going in between line, you are too close to another car, or you're getting lost because of geographic orientation, you are missing exit, or you hitting here and there when you drive on your car marks, that you a lot of fender bender or some kind of mild kind of accident, not even a proper accident, just hitting the garage door or hitting something. So those are the marker that your ADLs has changed, and those are the cross point that you cross the border from MCI and coming to the next stage, which is the dementia. So the dementia is not normal for your age. It is a decline in your activities of daily living skills, and it cannot be due to any other, just a medical issue. Say, suppose if you have a urinary tract infection or a dehydration, sometimes we do see some of those changes. That's not dementia. That's an abrupt change that we see from urinary tract infection, dehydration, pneumonia, all kind of medical illness, or drugs like alcohol use or alcohol withdrawal. Those we call delirium. So delirium is not dementia. Dementia is a progressive illness, whereas the delirium is the abrupt change in mental state, like an acute confusional state, meaning it's due to, most likely due to some medical cause, some medical simple things like UTI, pneumonia, dehydration, something very simple that can be easily treated. So that's what we have to separate dementia from delirium. Okay. So these are the criteria of all the changes, different stages of dementia. So different stages of dementia would be mild, moderate, severe. When you are in a mild dementia, meaning when you do the testing, memory testing, there is a scorecard we use, and the score says, suppose anything less than 25 or 26, we call it dementia range. And then if it is less than, say, suppose up to 15, we call it like mild to moderate, and then we call it moderately severe, and then less than 10 is the severe or profound dementia. So these are the different level of marker we use by the clinician to stage the disease, whether it's a mild dementia, moderate dementia, or severe dementia. And then, of course, after severe dementia comes the profound or advanced dementia, when you can't even do any more testing for anybody because they are too far gone. So these are the almost like a different stages of changes in life, coming from completely healthy brain functioning, healthy aging, to all the way to advanced dementia. So the focus point is not so much sad. I mean, I know this slide is very sad, but focus point today, I'm very optimistic. Focus point today, I wanted to focus on optimism. What can you do to slow down and push it further away from you? So these changes, you're going to be pushing away from you so that you can enjoy as long as healthy aging without declining quickly, like the way I'm talking about. Okay, so that is the purpose of our presentation. All right, so we talked about this protein, and this is the amyloid PET scan. When you do this is the scan that is still not payable by Medicare. I'm hoping that is very soon, especially with the treatment of Alzheimer's that's pending right now, when that will be available for public, we are going to see reimbursement by Medicare for payment for this amyloid PET scan, which is very good. It's like a way that you see the PET, different type of amyloid accumulation in the brain. As of now, we do have another PET scan, which is payable by Medicare, and it's an amazing PET scan. It's not amyloid PET scan. It's a scan that detects the functional status of the brain. It's called PET scan, but they use a sugar, like a radioactive sugar. So this one is called FDG PET scan, FDG. FDG stands for fluorodeoxyglucose, like a glucose, like sugar. So it is a sugar, but it is a radioactive sugar, meaning it has a radioactive fluoride, meaning fluoride is a radioactive isotope. They put the radioactive isotope in a normal sugar molecule. Why they do that? Why they do this kind of crazy thing? They do that because of the radioactive isotope in the sugar, the PET camera can actually visualize the sugar, where the sugar is going in the brain, so they can localize the sugar in the brain. Think about this, like how they tag a shark in an ocean so that they can study the shark where the shark is going. So they tag the shark and they see with the camera where the shark is going next. This is exactly the similar mechanism. So what they do when you go for this PET scan, you go to the neuroradiology department, they give you an injection first of this FDG, which is I talked about, radioactive sugar. So you take the injection and you wait for half an hour. That half an hour is the travel time for the sugar to travel to the brain. So you just read or do something for half an hour so that sugar is going to the brain now. Then they put you in a scanner. And now, because it has a radioactive isotope, they can actually see where the sugar is inside the brain. Because what the objective is, that our brain needs sugar for everyday functioning. This is why if you're not eating someday, that you get confused, you get like dizzy, you get like, oh my God, I can't even focus because I haven't eaten. We call that hypoglycemia, yeah? Because low sugar, because we need sugar. So the idea is if you have a healthy brain, then sugar should go all over the brain, everywhere. But if the sugar doesn't go to certain areas of the brain, that's how we diagnose different types of dementia, because that part isn't working. So for this slide, if you can look at the top one, it's the frontotemporal dementia, meaning sugar didn't go to the frontal lobe and sugar didn't go to the temporal lobe. See this red line? This is how we diagnose frontotemporal dementia in this PET scan. So this is a scan that is very diagnostic for this disease. Whereas if the sugar doesn't go to the memory part of the brain called temporal lobe, and the spatial part means the part that help you with navigation, space, geography, like driving, navigation, direction, that is the area called parietal lobe. And when the temporal lobe and parietal lobe, when the sugar doesn't go to these areas, then we describe that as Alzheimer's disease. When the sugar doesn't go to the back of the brain called visual cortex, where the visual processing of information happen, there is a different types of dementia. We call that Lewy body dementia. So this is how we diagnose different types of dementia. So this is a great scan. This is an amazing scan that is used for diagnosis of different neurodegenerative dementia like Alzheimer's, frontotemporal, Lewy body. And this scan is payable by Medicare. And this is an MRI. MRI is also pretty good. MRI sometimes is not it detects the changes in brain a little bit later, because what MRI does is the shrinkage in the brain called atrophy. So the way that our brain functions, remember we talked about the amyloid and tau, that's the first molecular level change happen. That takes 20 years, to have symptoms. But after the molecular level is damaged in the neuron, then it comes the functional level where the functioning is, like a sugar utilization or functioning is hampering. That was the stage when FDG PET scan can be positive, but MRI can be still negative at that stage. That can goes on for a couple of years, that functioning is impaired, then start the showing up in the structure of the brain, shrinkage in the brain. And then the MRI or the structural brain scan will be positive in those stages. So this is why sometimes if you do like a structural scan, like a CT scan, a brain MRI too early in the disease, that may be normal. It doesn't tell you that you don't have dementia, meaning those instruments are just not equipped to do early detection in that kind of molecular level. So that's why the PET scan might be appropriate in those stages. And always remember, even the PET scan, this one that I talked about, even this can precede clinical symptom, meaning you can still be doing fine, but your PET scan can be positive for Alzheimer's disease. And that sometimes happens. I have a patient whose PET scan is really, really bad, but he's actually not that bad clinically. And I'm telling that patient that, these kind of scans are almost like a weather forecast, what's coming. The weather forecast means, if something is coming, but you may not be there yet. So what can you do to prepare something so that you don't need to have that changes quickly? You can slow it down. And that's what happened, that we can do medication to slow down the disease. We can do, we'll do cognitive health strategy. I'm going to talk a lot about it in this presentation. Okay, so that's the PET scan, and this is the MRI. And now we're talking about what are the other risk factors for dementia. What is the reason that some people are healthy and some people go into this kind of dementia process? Of course, genetics is a big one, but other than genetics, age is a big one. As we know, as we get older, we're higher risk of development of Alzheimer's disease and other dementia. However, there are certain dementia that is not really so much because of age, like frontotemporal dementia. That's actually a young people's dementia. Most people in frontotemporal dementia, they're not old. They are even, I have the youngest as young as 35 to 40 years getting dementia frontotemporal. And then oldest, it can be 70, 75, 80. But anybody in frontal is very unusual to someone older age to get frontotemporal dementia. That's most likely a more younger age population get dementia with FTD, frontotemporal. So age is more appropriate with most dementia, but not for all. Especially the other one is the vascular dementia, like a stroke-related dementia. That also can happen. Of course, it can happen with the aging, but sometimes depending on your stroke, if the stroke happened in a very strategically significant areas of the brain and you have multiple strokes, that can cause dementia even though you may be in your 50s or early 60s. So that may not be so much age, but overall age is a big risk factor for dementia. Sex is definitely, we knew that Alzheimer's is still a higher in the women than men. However, there are other dementia like vascular dementia and something that also men are catching up quite quickly, because we know men actually has a higher risk factor, modifiable risk factor for dementia. And I'll talk about those modifiable risk factor, meaning the risk factor that can be modified, that can be, you have the more power about those risk factors. You can't change your age. That's why it's called non-modifiable, because I can be younger. I can say, I want to be 18 again. It doesn't work that way. So this age is not, sex is not a modifiable, ethnicity is not a modifiable, but we know there are certain ethnic origin has increased modifiable risk factors like American Indian, Alaskan Native, Black and Hispanic has a higher modifiable risk factors than Caucasian. So this actually, we just have a new publication as of today. I just updated this slide. JAMA, Journal of American Medical Association, they have a JAMA Neurology, just published a paper today about American born risk factor, non-modifiable risk factor for dementia. And this is why I added these two, modifiable risk factor for men and modifiable risk factor for this certain ethnicity, because this is just brand new findings that just came out of the JAMA Neurology this week. All right, so What is the modifiable risk factor? So this is something that we really have to work on. So the number one, these are the three triad that we have to remember. Midlife obesity. Midlife obesity means, in your 45 to 60, these are even 40 to 60, these are the age, very critical age. When we get increasing weight gain and obesity during this midlife, and we're not active physically, we are having a sedentary lifestyle, and if we also have a low education, that we didn't go to enough school, these are the triad for a complete, like a big risk factor for dementia. It's like a perfect, kind of triad for dementia risk. As you know, that education is a very good positive factor that can prevent dementia. More higher educated you are, more less likely your dementia would be severe. So it's not about the college. You can still do education like the way you're doing now. You are attending our advanced, this Stony Brook learning opportunity. We can learn any age. It doesn't have to be stopped. So more you get educated, less likely you will have progression in dementia. Even though you have dementia, I think a lot of the severity get less when you are higher educated or your brain is very active. Okay, so these are the first three triad. Smoking is a big risk factor. As you know, simple thing, smoking causes heart disease and stroke. So stroke and heart disease cause dementia, Alzheimer's disease. So smoking is a big risk factor. Drug abuse, of course. Anything that is contributing your heart disease, cardiovascular disease will cause Alzheimer's disease. So heart and the brain are connected. So if you have a healthy heart, you will have a healthy brain. So anything that your cardiologist tell you to do, neurologist will do the same thing. So it's the same thing that, the heart and the brain, whatever you prefer, just do this and you'll never have a heart disease or a brain disease. So this event, high blood pressure, especially midlife hypertension, when your blood pressure get really elevated during the midlife, too low blood pressure is also not good. Too high blood pressure is not good. Too low blood pressure sometimes can cause lacunar changes, like a microvascular changes, and that's not good either. So it's a good thing is a normal, healthy range of blood pressure. And that's why you need a regular wellness visit with your primary care doctor to make sure your blood pressure is controlled. Cholesterol, high lipidemia, hyperlipidemia is a big risk factor for stroke and heart disease, as well as diabetes. Diabetes is one of the major cause of dementia. Now, more and more we know about diabetes. It is so important, especially uncontrollable diabetes. When your diabetes, hemoglobin A1C is not well controlled, that causes single thing that causes microvascular changes in the brain, and that causes vascular dementia as well as Alzheimer's disease. And so this is a very important thing. It's a modifiable risk, so that you can have an endocrinology and work really hard to lose weight and make sure your sugar is controlled, make sure your blood pressure and all the risk factors for heart disease and stroke is controlled, so that you don't get a stroke. Because more you get stroke, more likely you get vascular dementia and Alzheimer's disease. I'm a big on the sleep, poor sleep hygiene, because I'm actually doing a presentation next month for our family medicine grand round, is the presentation on sleep and neurocognitive health. Anybody who comes to see me for Alzheimer's disease diagnosis, first thing I do, take a good sleep history to make sure they're sleeping adequately. They have a normal, healthy sleep hygiene, that they are going to bed at a certain hour, wake up at a certain hour. They have a rational way of sleeping all night long. They don't have any, nocturnal awakening. If they have any vivid dream or any kind of what they call REM sleep disturbance, like an unpleasant dream with acting out behavior at night, sometimes I will talk about those, but sometimes those can be the earlier changes in dementia. So sleep is a major, major risk factor. You know, remember one thing, if I have to take one little thing to take home message for you, that only and only when we sleep, our cerebrospinal fluid, remember I talked about there's a drainage for all the toxin to come back from the brain to the kidney. These excretion of toxins happen during the sleep only when the CSF, cerebrospinal fluid, do the drainage. If you're not sleeping, those toxins are not really cleared that good. And also during the REM sleep, during the deep sleep, that when we're sleeping, deeper portion of the sleep, we have a chemical in the brain called glutamate. This glutamate is the one that condenses all the memory that you have. So I always give a little story. So the story is very oversimplified. It's like everything that I'm talking about right now, your hippocampus, the part of the brain that controls your memory, is kind of lighting up as you are hearing me talking about it, because you're learning everything from me right now. But your hippocampus is just lighting. It's really not retaining any information yet. Not until tonight when you fall asleep. When you go and fall asleep tonight, only and only then, this chemical, little chemical called glutamate, walk into the hippocampus and say, hi, buddy, where did you go all day? What did you learn all day? And the hippocampus will tell that, hi, I went to this Dr. Absar and she went for all kind of information and learned. And then glutamate will say, do you want me to make some money, memory, not money, memory, that I can condense all the things that you learn and make a long-term memory for you. Only and only when you sleep, that condensation of memory happen. Okay, this is the glutamatergic process of condensing of the memory. So think about if you didn't sleep tonight, you didn't have the learning process develop into memory. So all the things that I told you today, you will be lost by tomorrow if you didn't sleep. That's why sleep disorder can look like dementia. That's why anybody who comes to see me, I always inquire about sleep apnea. I inquire if there any trouble with their sleep. They have depression, because depression can cause sleep problem. Anxiety disorder can cause sleep problem. So any insomnia or sleep apnea or sleep disturbance need to be stabilized before you can even diagnose somebody with dementia. That's why so good to see a sleep specialist, so good to have a sleep apnea. Make sure you don't have sleep apnea. If somebody's saying you are snoring at night and you always wake up feeling fatigued or falling asleep in the daytime, then question yourself, do I have sleep apnea? And also if you have an obesity so the good treatment of weight loss is that your sleep apnea get better, more you lose weight. But definitely you need to see a sleep doctor, because that is a primary gateway for development of cognitive impairment, okay? And then we talked about the mood disorder and stress, depression, which is a big marker for dementia. Depression can cause a syndrome called pseudo dementia, they used to call, meaning it's almost like a dementia, but only good thing is if you treat the depression, your dementia get better. So it is a reversible cause of dementia. However, certain dementia, a dementia called vascular dementia or Parkinson's dementia, those dementia, depression can also be a presentation, first presenting symptom, not memory. Your first presenting symptom is late onset depression, meaning you never have psychiatric history all your life, and all of a sudden in your 70s, now you're really depressed and apathetic or having complete lack of motivation. That is a warning sign of dementia presentation sometime, okay? So that's what you need to see a neuropsychiatrist or neurologist just to make a really good workup for whether it's a dementia or depression, okay? So these are the all red signal, that red alert that you should look for. Biggest one is the sensory deprivation that, again, this week's JAMA, Journal of American Medical Association in Neurology, just published another paper on the sensory deprivation. There's a paper on the visual impairment as a modifiable risk factor for dementia. Meaning what? Meaning if somebody having a hearing impairment, they may misperceive things and they're not learning properly. And that may look like they're demented. So before you diagnose or think about somebody has dementia, please correct their hearing. Please correct their visual problem. So that get them eyeglasses and have them a hearing aid and then do the testing for memory. Because chances are you are not learning and retaining because you are not seeing properly or you are not hearing properly. So hearing impairment and sleep deprivation, as well as sensory deprivation, these are easy to fix, but modifiable risk factors for dementia. Finally, head injury, more you fall, more likely you will have dementia. So late, especially elderly falls, falling is a big risk factor. It can not only falling cause subdural hematoma like bleeding in the brain, but multiple falling can cause that protein that I talked about. Remember the tau protein that I talked about before. They accumulate the tau protein, more you get concussion or more you get injury in the brain. This is why all the younger football players nowadays getting dementia because of multiple concussion in their brain, causing the tau protein accumulation that cause a type of dementia. We call it CTE, chronic traumatic encephalopathy, which is a form of dementia that is we see that for people with a contact sport like soccer player, football player, boxer like Muhammad Ali had that. They used to call boxers dementia before. All right, so those are the modifiable risk factors. So one by one, you got to modify them. If you have obesity or weight gain, and if you're not physically active, have a lifestyle modification. If you didn't have a chance to go to school or didn't have a chance to read a lot, then maybe it's time for you to do more brain exercise, more cognitive exercise, reading, crossword puzzles, or doing more brain functioning, even going for different TED Talk, learning a thing, that our program that is Stony Brook, this is a great program for learning different things. You can learn not just medical stuff, you can learn anything. Any learning will help your neuron to grow and make those connections that will help you to slow down the progression of the disease, progression of brain, the degeneration, so that we can prolong our normal healthy aging process. So in a summary of the neurocognitive health that I talked about, that first, of course, the stress management and a wellness visit. So you see your primary care, make sure you are not stressed out all the time with the life that we're having right now with, oil, gas price and, inflation and all kind of things that making our life so stressful. I think it's so time for us to have a stress management policy. How can you have a good, healthy brain without any too much stress? Vascular risk factor, we talked about diabetes, blood pressure, cholesterol, obesity, sedentary lifestyle, depression, anxiety, those all can cause heart disease and stroke. So those are all risk factors for dementia. Biggest one that I was going to talk next is the diet and nutrition, which would be our next topic. So healthy brain food. And then, of course, we're going to talk about the exercise. So this would be our prevention for dementia checklist. We're going to have a periodic wellness visit for your primary care physician as needed. If you have a chronic medical condition like diabetes, blood pressure, cholesterol, heart disease, make sure they're all stable. Make sure they're all well controlled. Avoid prescription medication that has a toxic side effects. And these are the 3 classes of drug that can cause dementia. Do not ever take it without consulting your primary care physician or pharmacist, okay? Biggest one is so overly rated and everything so commonly available in the CVS and Walgreens, as if like these are not even pill, everybody's buying it. But these are called antihistamine medication. Antihistamine meaning like a Benadryl, the medication that is allergy medication, cold medication, cough medication, medication that people take it for sleep. These are dangerous. So if you have a sleep problem, ask the pharmacist to give you melatonin, or ask the primary care to give you proper sleeping pill, not those cold medicine, that Benadryl like pill that they market for sleep, because that will cause dementia. Remember, dementia means you have increasing histamine. When you have a healthy brain, meaning you have your histamine, which is a chemical that makes us alert throughout the day, and acetylcholine that help us with the memory is good shape. Alzheimer's disease, when you have a low histamine and low acetylcholine, think about Benadryl. What Benadryl is, antihistamine, meaning what? Meaning it will decrease the histamine. It's antihistamine, so make you almost like an artificially demented. So you don't have to take those. Another medication class called anticholinergic, meaning this is the medicine we prescribe by a lot of urinary bladder doctor for urinary retention, like ditropin. Ditropin is the worst one. So anytime you go to see your urologist or your bladder specialist, if you do have a memory problem, you've got to tell them that please do not use medication that will interfere with my memory, because I don't want to take ditropin. Ditropin is, there is a lot of alternate medication they can prescribe. And most urologists would know once you tell them that if you have any memory problem, or if your loved one has any memory problem, to avoid those medications that can cause dementia-like symptoms. And then definitely benzodiazepine like Klonopin, Ativan, Xanax, please stay away from those as much as possible, because those can cause significant paradoxical dementia, like a confusional state. Okay. Reduce alcohol content, quit smoking, those are usual kind of modifiable things you can do right away. Proper hygiene and in sleep, at least 7 to 8 hours of sleep at night. And then reduce the fall risk as much as possible with the changes in your lifestyle. So if you have a multiple stairs and you have to, maybe simplify your life at certain age, maybe you do everything in one level, so you don't have to go back up. Lifestyle modification is so important with aging. Make life easy, make life simple, so that you don't need a big house with a yard to take care. You have a small condo, let people take care of that. Have a wonderful, living like a king and queen. Let people take care of you, so that you don't have a high risk of falling, high risk of all kind of injuries that it comes with it. But maximize your cognitive, physical, and mental function in other activities like exercise, brain exercise, physical exercise, mental exercise, things like that. So the neural pathway, nerve is a very complicated, like the way that is, showing that it has a lot of different nerves coming from different level, different areas, different part of the brain it going through. And these are all communicated by this chemical called neurotransmitter. These are the brain chemicals. So some of them is, I talked about glutamate a lot, which help with the condensation of memory that I was talking about earlier. Then they also have something called GABA, which is an abbreviation for gamma aminobutyric acid, big name. GABA help with the mental relaxation of the brain. So this is really, when you have low GABA in the brain, that causes anxiety. So anxiety disorder means you have very low GABA in the brain. Low GABA also causes epilepsy, like seizure. So these are the GABA help you to stabilize too much activity in the brain, so that your brain is not hyper, brain is functioning right in the middle, not too low, not too high. This is really, really important. So glutamate kind of excite the brain, and GABA kind of slow it down. So this is how God has given these two chemicals, one from extreme line. One is glutamate, help you to keep the brain active, and GABA to help you to keep the brain slow down. So when glutamate gets too high, GABA slow it down. So when you have a problem in the balance between the glutamate and GABA, that's how different disease like mood disorder, bipolar disorder, anxiety disorder, a lot of the psychiatric condition starts when you have a dysregulation of these chemicals in the brain. They call it chemical imbalance. So, and then comes the other chemical, other amino acids, which is called dopamine. Dopamine is a molecule of happiness. So anything that we're happy, we're feeling good, is all because of dopamine in our brain. So dopamine is essential to keep our muscle moving. When you have lack of dopamine in the brain, especially in the movement area of the brain, we call that Parkinson's disease. That's what the Parkinson's is, with a lack of dopamine in the movement part of the disease. When you have lack of dopamine in the prefrontal cortex, which is our motivation and mood part, we call it apathy, lack of motivation, depression. So dopamine, depending on where it is, can play different things at different times. Similar to dopamine, we have serotonin, which is a chemical that helps with the anxiety and mood. So lack of serotonin also causes anxiety disorder, PTSD, mood disorder, and a lot of antidepressant, basically antidepressant increase the serotonin in the brain sometimes. Same as the norepinephrine also. Norepinephrine is a chemical for anxiety that help with the heart rhythm. So, this is all the chemicals in the brain help to keep our brain active. These are all available in our food. So we have to talk about what we eat every day, because if you are concerned about your brain, you have to start thinking about what are you putting in your mouth, because everything that you put in your mouth will define who you are. So the neurochemistry, everything that we see, these are actually synthesized. A lot of the things is not synthesized by the brain. You have to transport through the food, through the molecule, through outside. So you have to make sure you have a healthy diet, healthy brain diet, brain healthy food, so that you can get all the neurotransmitter you need to proper chance to get synthesized, so that you have an adequate neurotransmitter. You don't getting memory, anxiety, mood disorder, all kind of things, because food is a big element of cognitive health. Diet is a big element of cognitive health. So, so these are available in certain. So here is it: norepinephrine, dopamine. These are the food that you can actually get. The biggest food source for a lot of the this kind of neurotransmitters is the fish that has the omega-3 fatty acid. We consider that as a MIND diet now. I'm going to talk a little bit about a diet called MIND diet, MIND, like a mind. It's an abbreviation. I'm going to talk about that diet because that's a diet that I prescribe for memory, because it can help to slow down the progression of the memory loss. And so that's a great, it has a lot of salmon or a lot of fatty fish has omega-3 fatty acid, and that is a big one for that. The other source of these neurotransmitters, almond, all the nuts, that avocado is it's a plant-based protein and high HDL, high fat content. Banana has a lot of dopamine and tyrosine, which actually basically gives rise to this dopamine. So banana is a good antidepressant-like action. So eating a banana is a good, very healthy brain food, and then of course the beans and seeds like sesame seed, pumpkin seed, dark chocolate, these are all good for neurotransmitter source. And we talked about the dopamine is all about the happiness. It helps with the attention, motivation, pleasure, like love. Anything that we fall in love is because of dopamine. So that's what, I always fun about Valentine's Day. I tell my friends that don't say, will you be my Valentine? Just say, will you be my dopamine? Because the reason you fall in love with somebody, because dopamine is attracting another person. So dopamine is a molecule of attraction, is a molecule of love, is a molecule of pleasure, is a molecule of also this addictive behavior that you do things over and over, like drug abuse is a dysfunction because of dopamine. So it's a strong chemical, but as I said, it's also available in food what you eat. So you have a healthy food, healthy brain, healthy food. you will automatically have these chemicals, in your food transported to you. So this was the slide I was making jokes about. Will you be my dopamine? So this is basically dopamine, how many function dopamine can do. As I said, low dopamine can cause, Parkinson's disease. So dopamine is a cause of Parkinson's. It is a pleasure. It is a cause of pain sometimes, neuropathy. It is an addiction pain. So all kind of things that we see because of dopamine. So these are the disease affected by dopamine. When you have a dopamine depletion, we call that Parkinson's disease or ADD, attention deficit. When you have too much dopamine, that's not good either. That actually causes schizophrenia or psychosis. So that's why Parkinson's disease and schizophrenia or psychotic disease is kind of mirror image from each other. So the Parkinson's disease is too little dopamine, whereas the schizophrenia is too much dopamine. So when you have schizophrenic patient treated with antipsychotic medication for their hallucination and delusion, if the antipsychotic medication decrease the dopamine too much, then what's going to happen? Their dopamine is now too little. They will get Parkinson's. So this is why a lot of antipsychotic medication can get Parkinson's as a side effect. And same thing can happen with Parkinson's disease patient when they have too much carbidopa, levodopa, or some of the dopamine medication. If it is happen, sometimes, very rarely, not so much with carbidopa, but there are certain dopamine medication can cause more hallucination. That's because that can increase the dopamine too much, making you hallucinate. So these are very, very common disease because of the dopamine imbalance. Acetylcholine I talked about, this is a molecule of memory. This is what the memory molecule like. You probably heard of the memory medication called Aricept. Aricept or donepezil, which is a molecular, it's a medication for memory we prescribe. That's basically a acetylcholine medicine. That basically increase the acetylcholine in the brain, which makes you memory, makes you remember better, at least to slow down the progression of these. And look at that. This is the chemical synthesis of acetylcholine. How acetylcholine make in the brain. It comes from this homocysteine. Homocysteine needs vitamin B6, vitamin B12, and folic acid in order for this to transfer into this chemical called methionine, and methionine goes into acetylcholine. So if you don't have vitamin B6, B12, and folic acid, then you're not going to make acetylcholine. Meaning what? Meaning your memory is not going to be that good. So vitamin deficiency can look like dementia. So that's why if you are deficient with these B vitamins, you can look like demented. But it's so easy to fix. You check those vitamins level and you take the vitamin supplement and your memory is better. So that's what, these are so easy to fix, and these are all available in your diet. Serotonin, we talked about, banana, all kind of things. It has serotonin synthesis also needs vitamin B6, B3. See, these vitamins are so necessary for your diet. So that's why you're not eating these vitamin rich vegetables and fruits. You're not going to get a lot of these vitamins if you are not eating you are just eating, animal product or not eating plants or vegetables. So you're deficient with a lot of these products. And then finally, the GABA, the relaxation molecule that help, it helps to relax your mind. There are physical activity that improve the GABA. One of the biggest one is the yoga and meditation. We have a lot of research on the meditation, like mindfulness and yoga. In Scandinavian, they have studies with the Buddhist monk, and they showed with a different FDG PET scan that the patient, they have, characterized yogis with normal, controlled, healthy group, and found people, yogis, like yoga practitioner who does mental relaxation and meditation, they actually had a pretty good GABA in their prefrontal cortex. We actually had a good research at the Boston University. It got published by one of my colleagues from BU Neurology. And they produced this, make this article published that yoga and certain mindfulness activities increase the GABA, and guess what? GABA lower the nervousness, racing thoughts, hyperactivity. So it's help with the mental alertness, relaxation. So these are very, very common. That's why mindfulness is so important. And that's why as a yoga practitioner, I really propose yoga as a therapy for brain health. So if you haven't done yoga or even mindfulness or meditation, utilize that in your daily practice, because that help you to relax your mind, stress management, and kind of help to focus better, which help you to remember better. So this is an old saying in France, you are what you eat. So basically, this is like an old saying that, tell me what you eat, I'll tell you who you are. So this is basically the way that you can think about that, how we have the good control of our brain, for our body, for our heart, just the way we can, kind of modify our eating habit, take some of the brain healthy, heart healthy food in our daily choice that we make. With that, I'm going to come to my real topic of diet. Is a diet called Mind Diet. I think I have been talking about that. It's one of my passionate area. So Mind, M-I-N-D, stands for it's a big name. So it's a stand for Mediterranean. It's a two diet together. One is called Mediterranean diet. You all know about the Mediterranean diet. And there is another diet. I don't know if you guys are aware about the second diet. It's called DASH diet, D-A-S-H, DASH. It's an abbreviation for dietary assessment for high blood pressure. So basically, it's a high blood pressure diet. So DASH diet is a diet where you have a low salt and low carbohydrate and low fat. And Mediterranean, you already know, when you marry these two diets together, Mediterranean diet and DASH diet, that becomes the Mind diet. So Mind diet is a hybrid diet between Mediterranean and a DASH diet together. So what is MIND stands for? So MIND stands for Mediterranean Dash Integrated Neurodegeneration Delay Diet. Long name. What does it mean? Meaning the Mediterranean Dash Integrated, meaning they both hybrid, they combine the two diet together. Neurodegeneration, meaning the shrinkage that I show you on the MRI, the shrinkage that happen in Alzheimer's disease and other dementia. Delay, meaning you can slow down the shrinkage by eating this diet. They have a huge study. Initial study was in Scotland. So there was a big group, two groups. One group was a 65 and older people who were otherwise healthy. And these are the people, they don't have dementia. They're just healthy aging population, 65 and over. So they divided them into two groups. One group, they asked them to only eat Mind diet recipe. The other group eat whatever they want to eat. This was a 3-year-long study. At the beginning of the study, they have a brain MRI done just for the baseline, just to see how the MRI looks like. After 3 years, they have the MRI for both groups, the group for Mind diet and the group without any diet. They found something amazing. What they found, that people with the Mind diet, they have slowed down their shrinkage when they compared the second MRI with the previous MRI. They slow it down. All the shrinkage that you see because of aging or dementia was slowed down because they ate this diet. So this is how it became a big name in Europe and of course then in US. And we replicated this diet in Chicago. And then we became very much into this Mind diet as a diet for memory or Alzheimer's disease. So American Academy of Neurology does endorse Mind diet for neurodegenerative disease. So we strongly recommend Mind diet for any neurodegenerative disease. And to be honest, it's also good for your heart disease. It's good for anybody. So it's good for everything. So it's a Mediterranean diet. It has a cardiac benefit. We all know about that. It has all our cardiologist has been telling us about this diet for quite long time. They focus basically on fresh fruits and vegetables, being a lot of fish. The salmon is the biggest one because remember, everything about the omega-3 fatty acid. Salmon has the highest omega-3. They have the highest HDL, high density lipoprotein. So the good fat that actually protective to your heart, protective to your brain. So eating this diet will help you to build up the good fat, while the bad fat, what is the LDL or low density lipoprotein, which is basically beef and pork and butter and margarine, all kind of thing that makes you heart disease and stroke. So if you can lower the LDL and increase the HDL, that would be, your cardiologist would love you for that. You know, you don't need a statins, you don't need all the cholesterol pill, you don't need all the blood pressure pill if you start with your diet, because chances are diet would be so important to cut down a lot of the dose of your medication, even though you may need those medication, but maybe you don't need 5 of them. Maybe your cardiologist and your primary care can cut down a lot of the medication because you are losing weight, because you are so healthy, because you have a good heart, good diet now. So in addition to cardiac benefit, now we know that this is a diet, the DASH diet and Mediterranean diet has been shown to improve the cognition, you know. So this is why I think we strongly recommend mind diet to these. And this is the research that we're replicating at the Rush University Medical School in Chicago by this wonderful dietitian, nutritionist, Martha Morris. So Martha Morris published this big paper on the mind diet, which becomes a big Bible in neurocognitive health. You know, now everywhere you go, we all talk about mind diet. If you hit Google mind diet, I always struggle my patient, I always tell them, please Google mind diet recipe and print out all the food that you can cook with the mind diet. Buy books, you know, they have several books, you know, New York, like a #1 bestseller list, a lot of the books on mind diet. You know, there is a book of mind diet as a mode of, I think it's a long caption, how can you slow down the dementia. It's available in Barnes and Nobles, available in any bookstore. So pick up a book on mind diet and just try to modify, even though you may not change your whole lifestyle in one day, but maybe adding something. You know, mind diet has also recipe for, you know, people who, you know, wine drinker, like they do allow you to have a glass of red wine, which is sometimes no more than 5-ounce glass. It's funny because when I was in Maryland at my last previous job at Hopkins, I used to work at that one of the assisted living facility, which is connected with my clinic. So one day I'm passing the assisted living facility, and they used to have a bistro, like almost like a bar in their assisted living. I see one of my patients sitting there in the happy hour bar and with a red wine in his hand, and he's yelling at me, Dr. Absar, look, I'm having mind diet. So next day he comes to see me, and I'm like, I saw you're having mind diet. Is it the only mind diet you really need, or you have something real mind diet? So he probably heard about my mind diet with the red wine, but red wine is just one of them. But mind diet has everything else. It has all the foods that you need, like fresh vegetables, green vegetables, fresh fruits, and definitely all the greens and all the fish, or you can have chicken, lean meat like chicken and turkey, but not the red meat as much as possible. Leafy greens and berries and nuts, these are all part of the mind diet. So this team of Rush in Chicago, Morris and the team, they nearly decade studied a lot of patients with Alzheimer's disease. They followed even patient who has Alzheimer's they lowered the risk of Alzheimer's as much as 53% by just following this diet. So this is a great diet for prevention of cognitive impairment as much as possible. But as you know, diet alone cannot prevent Alzheimer's disease because there is genetics. And there is also, I discussed about other modifiable risk factors like smoking, exercise, or level of physical activity, level of education. So more, you're not sedentary, you are not active with your brain, and your mental health, like a stress level. Those are all play a role. So don't forget about those. But the mind diet can be protective for our cognitive brain health and physical health. And diet has to be complemented with a structured daily routine. So as we get older, we get retired, we feel like we have no purpose. You know, the reason we feel we have no purpose sometimes because we don't structure our day like the way you did when you were working. Because you wake up at certain hour, you go to work, you come, home, you do certain thing. So you have a daily routine. So try to maintain a daily routine, even though you are not working anymore, even though you are retired. Who cares? Even though you are retired, wake up at certain hour daily, 8 o'clock or whatever, you pick up a time, but don't stay in bed after that time. And then make something grooming for yourself. Like if you feel like you have a fresh clothes, you took a shower, you put some, like a self-care for yourself, you'll feel better. And then you eat, you think about what you're gonna eat. Make that choice between that mind diet choice that, okay, I'm gonna pick this for breakfast, this for lunch, this. And then maybe plan for a walking or exercise plan. That whether you're gonna go for a walk today, you're gonna run if you are a runner, or even, if you know yoga or meditation, do something, add something in your practice, and just make a whole day and make sure you got sleep, you got good exercise, you got good, stress management. So this is how you got to make a plan for your daily structure every day. And then yoga, of course, yoga comes from an Indian Sanskrit called meaning of union, which is a union of mind and body, yoga. So it's a union of mind and body. That's why it's so important for relaxation. So it bridges the mind and the brain through the breathing. It basically helps you to regulate your anxiety or your stress by breathing techniques. So it's a great way, great techniques as a therapy, and you definitely can benefit from that in a daily life. It helps with the mood motivation, help with the focusing, and definitely sleep. It helps a different kind of obsessive thoughts that if you have your brain gets monkey brain, it just cannot stop. It goes on and on. Those are the things that you can do meditation, a little bit of mindfulness technique. If you have a computer savvy or somebody like a grandchildren or someone, ask them to show on the YouTube and have a video on yoga and maybe basic yoga, just see how they're doing some basic yoga and do something with them when you are watching a video or something. So that really help you to structure your day as a good cognitive exercise for the yoga. Help with this brain pathway. It's the hypothalamus. This is the pituitary gland. This is the adrenal gland, the stress hormone level. See how they can actually stabilize and increase something called parasympathetic nerve. We have two kinds of nervous system. One is called sympathetic nerve, which activate our stress. One is the opposite, called parasympathetic nerve, which deactivate the stress. So this pranayama, meaning this breathing exercise in the yoga, can activate parasympathetic nervous system to help to relax the stress and make you less kind of stressful or anxious by overactive, these underlying sympathetic activity, cut down those activity. So everything that I talked about for the last, these are the way that we can modify our life to prolong our healthy aging so that we can push down further away from us all the things that will interfere with our healthy aging, make us more susceptible for dementia and all the abnormal accumulation of protein and everything. I say, if we have a genetics, of course, genetics, you can't change anything if you have a genetics, but you can still modify, maybe slow down, maybe somehow to slow down the progression of the disease. So even though somebody has a dementia diagnosis already have, because of this, cognitive health can slow it down so that they can still be at the mild stage of the disease as long as possible, not to go too quickly to the severe stage. My final slide is a slide for a spiritual slide from Buddha. This is really very close to my heart. Buddha said, in the end, only 3 things matter in life, nothing else. You're not going to take anything to the grave. Only 3 things happen, only 3 things you need. Number 1, how much you loved. We all been loved by our family, by our loved one. That's a blessing that we have family, we have loved one. So number 1 is how much you love. Number 2, how gently you lived your life. Think about you. You worked so hard all your life. You came through a long time. You struggled, you did good education, you went to college, school, brought up children, you did hard work throughout your life. So you should be proud of that, how gently you lived your life. Number 3, which is the hard one for me, and I think hard one for anybody, how gracefully you let go things that doesn't mean anything for you. Meaning anything that doesn't mean anything for you anymore, just let it go. If you're not let go your past, you're not going to move forward. Sometimes we hold everything from the past, and that kills us because that makes us not moving forward anymore. So in case if you have a diagnosis of dementia, this is what I tell my patients. These 3 things in life matter. Just think about, Buddha said 3 things matter: how much you love, how gently you live your life, and how gracefully you let go things that does not mean anything for you. So whatever you have a diagnosis, who cares? What can you do to slow it down? Maybe you can slow it down. It is what it is. If you have a PET scan showing you a diagnosis, it is what it is. But what can you do to slow it down so that it doesn't come quickly? Remember, I said brain change happened decades before clinical symptom appear. So what can you do, even though your brain may have changes, but clinically you still continue as a healthy life, as a healthy aging process? Okay, with that, I am going to stop.
Thank you, Dr. Absar. We do have some questions in the chat if you want to stop sharing your screen.
Okay.
Let's see. So Barbara asked a question. Do you want to ask her directly? I don't know which Barbara it is.
Yeah, Barbara, do you want to, let me see, how do I?
Barbara, are you on?
I think I asked about, I'm 68 now, but when I turned 65, all of a sudden I started waking up extremely depressed. And then it would always go away though, after I ate some food and I drank coffee, like a normal cup of coffee, it would completely go. So I discussed it with my doctor. We decided I don't need an antidepressant because I'm not depressed in the late afternoon and the evening. So why get those side effects? But it's like, it's 3 years. It's like I could have the most fantastic weekend. It's like, there's no way I can be depressed when I wake up in the morning. I'm so happy. I wake up the next morning, I'm depressed again. And then I have to drink the coffee and eat food. And I'm thinking now that it's just brain chemistry because it's not even logical because it doesn't last all day.
I mean, possible. I mean, that's a great question. I think if it works for you, hey, that's good. So
I'm wondering if it's brain, because I never had anything like that in my entire life. So I'm wondering if it has something to do with getting old, like it's a brain chemistry.
Yeah, I mean, as we get older, remember the slides I was showing, we do have shrinkage, normal shrinkage in our brain that will not just decrease in the memory molecule, It will also decrease the molecule for sleep, like melatonin, molecule for mood, like serotonin, molecule for muscles or movement, like dopamine. So our movement gets slowed down as we get older. Our mind gets a little bit nervous or anxious. Our sleep gets less and less, comfortable sleep. So we wake up more. So this is a part of aging anyway. So yeah, so those can be as we get older. But if you feel like you're not ready for antidepressant, but I think the most of the modifiable things that I talked about, let's start with those.
Yeah, I think it's a great, because there's a few things I'm doing wrong. Like occasionally, if I can't sleep, I'm anxious, from regular life things, I'll take a very small dosage of an Xanax, and I'm thinking maybe try not to take the Xanax.
I would love you not to take that pill,
At
but
night.
I hate that because that's one of the cause of dementia pill.
Okay, I'm glad.
So do not take those kind of, remember, those are benzodiazepine, Xanax, Klonopin, Ativan. Do not. Melatonin is the benign, it's over the counter, you can buy. And that's because melatonin, remember, we have the protein melatonin in our brain that helps with our circadian rhythm. But this over-the-counter melatonin, not exactly the same, but at least it's not toxic. So you could, if it help you, you could have that. Have some hypnosis, like a meditation at night. Music sometimes help you, soothing. So those you could do some non-pharmacological intervention. Meditation is a really good thing if you are good with meditation or learn about the techniques. To do something at night to sleep better. But if you cannot sleep, it's okay to find out what are the causes of sleep problem. Because remember, sleep is a symptom, it's not a disease. What is causing the symptom, that's it, the disease. So I hate when people give a sleeping pill without knowing what is the cause of the sleep. So when you go to the doctor, you should ask the doctor, if you don't know what I'm having for sleep, send me for a sleep specialist, so that they would find out what is the cause of my sleeping problem. Is my sleep because I'm too anxious? Is it my sleep because I'm too depressed? Is it my sleep because I have restless leg syndrome? Is my sleep is because I have sleep apnea? What is the cause? So if giving a sleeping pill is not going to be, it's like throwing a stone to something what you're not, what you're throwing at. So that way you got to always try to treat this disease, not the symptom. So if you have a headache, one day Tylenol is good, but don't take Tylenol every day. Find out what is the cause of the headache and treat the cause, not the symptom. Okay, just remember.
When I was saying that coffee helps me, it's like dopamine hit. I mean, is coffee bad or good or makes no difference in terms of brain chemistry for seniors?
I think 1 or 2 cups, I can survive without coffee. So you are asking a wrong person. I love my morning coffee, but more than 2 might be too much. I would say that's caffeine is theophylline is an amphetamine-like compound, is a stimulant. So that would increase your stimulation in the brain, make you jittery, make you anxious, make you more like this, so 1 or 2 may be helpful for focusing, helpful for wake up, but everything in moderation. Yeah. That's all I can say.
Okay, thank you.
Thank you.
Well, Dr. Absar, one of the next questions was, can Xanax cause dementia or affect it?
I think we mentioned that anyway. Yeah, it doesn't cause, but it will cause symptoms like confusion and memory impairment. We actually had a new study of long-term benzodiazepine can cause dementia-like syndrome. So if you're taking this for long-term, 30, 40 years, then of course you are putting yourself at high risk for dementia.
Okay, and then Doreen asks, what can be done for allergies besides antihistamines?
Well, that's a great question. And that's how maybe you need to see the allergy specialist, because there are a lot of non-histaminic allergy medication, or allergy medication that has less of the H1 receptor, which is a type of receptor that goes more in the brain, and more in the peripheral histamine receptor, which may be good for the, itching or something. So see a specialist, but also talk to the pharmacist, like what are the allergy medication that is like, claritin or things that has less Benadryl in it, So yes, so discuss about a specialist or at least the pharmacist before you buy anything for allergy if you have trouble with memory.
Okay. Doesn't coffee increase dopamine?
So my question.
So the coffee is not so much dopamine, it indirectly increases the dopamine. Yes, but but it does release a lot of the stimulant kind of neurotransmitters, they have biopeptide and a lot of the different things that stimulate, but indirectly it also increases the dopamine indirectly by interaction. So yes, it is a stimulant. It does, kind of make you jittery, but it has benefit too, and so one or two, as I said, I think it can be good for you focusing, good to start a day. We don't have a long-term study for so short-term, some of the benefit you must have seen every day they change a lot of different benefits in a day. So someday they talk about how it's good for Alzheimer's disease, and next day you say, no, don't drink it. If you drink too much, But bottom line is 1 or 2 don't hurt. I think it's good for you in moderation.
Good. So Shelley asks, is doing Tai Chi beneficial?
Absolutely. I think I'm not a big person for Tai Chi, but I believe a lot of my patients that I see, they are taking some of the course from you guys, Liz. I think do you have a Tai Chi course or something?
We did. I don't think we have it right now.
Yeah, I believe one of my patients has attended, and this is a great techniques in Chinese, Eastern Chinese, earlier ancient China. I mean, that's very good for coming down, so I think that's very similar to yoga, but it's so much benefit.
Yeah, I've heard the same. So we have another question about food. Barbara asks, can food with sugar like cake and cookies contribute to dementia?
Oh my God, big one. Big one. That's why the Mind Diet. Mind Diet is a combination of the low carb, low fat, low sugary stuff, and then high in the HDL. So absolutely, too much sugar definitely is not good for your brain. Makes you so there is so sugar craving can be a symptom of certain dementia. One of the major one is the frontotemporal dementia. One of the major symptom of FTD, the frontotemporal dementia, is carbohydrate craving. So these are the people are so impulsive eating. So they will look for food with sugar, and not just the complex sugar, the simple sugar, like really cookies or ice cream or, that will get. So these people are so dangerous because I worry about them so much because they can get type 2 diabetes so quickly. And diabetes is one of the risks for stroke. So more you get stroke, more dementia will get decline. So that's why it's in dementia, these are impulsive behavior. So you have no control. It's very hard to control when you have frontotemporal dementia. But yes, for anybody, I would strongly recommend low sugar diet. Some carbohydrates are really good. Complex carbohydrates are much better than the processed or the simple carbohydrate, which just break down to sugar right away and gives you the highs, and sugar, as you can see from the children, I mean, ADD like symptom, they get jittery, they can't focus, I think. So the low sugar is really good. And beside, I think if you're looking for the good heart healthy diet and brain healthy diet, then low sugar is the key, and low fat and low sugar.
What about the to piggyback on that, what about the other types of sugar, like natural sugars, like stevia and honey and things like that?
Honey probably would be much better choice.
Yeah.
It's a natural. I would not recommend stevia or anything because there's a lot of literatures out there about the artificial sweetener. I mean, so yeah, but I believe there are some stevia that has, I saw one paper on that, but I don't know if it's a long-term study, but this is not the one that you commercially available. This is almost like an extract, certain extract available in certain health store, like Whole Food may have some so those kind of might be okay. But I would say cut down as much as possible.
Yeah, well,
Honey is a good one, actually. Honey.
some people think they're getting something natural because stevia is a plant, or other things like that. But it's really what they're putting in it, how they're processing it, and it's hard to know.
That's exactly it.
Yeah. Is there yoga for people with arthritis?
Oh my God, big one. Absolutely. Just so remember, yoga is not about that what you see yoga in Western culture. Yeah. We are so used to yoga in like California, like a Hollywood culture, like all the hot yoga, all the 5 feet, 6 feet tall young girls doing yoga. So everybody gets scared. Like, I'm not flexible. I can't do yoga like the way that the girl is doing. No, yoga is an ancient therapy in India. 5,000 years ago, yoga came. It was a therapy. It was a therapy, like physical therapy. They used to do yoga in Indian culture back in those days, like a medicine. So if you have a constipation, they will give you a yoga pose to do that. If you have a arthritis, they will give you a yoga pose to do that. So yoga is almost like physical therapy. So it doesn't have to be a full class to do yoga. We are so much into this class yoga. Back in India, if you even go to yoga, they will say yoga means you can have just one pose, and that's yoga. Yoga is modifiable. So even though if you have a stroke, you can't move, you are only chair bound, you can do chair yoga. There is a yoga, they can do chair yoga. They have actually, every nursing home is mandated now to have a chair yoga instructor in their nursing home, because that gives you the mobility, stretching, even though you are not moving, that gives you the exactly same benefit like an 18-year-old girl doing in their mat. So yoga is modifiable. You can modify every pose that you do by just changing the yoga posture. So we have an old saying, never, what is it called? The yoga teachers always tell you that never brings the yoga pose to your body. Bring your body to the yoga pose, meaning you have to modify according to your yoga body and according to your body. So if you can't bend because you have arthritis, do not try to bend like this, because that will be dangerous. So modify every pose according to the structure of the body, according to your, whatever you have. So that's the key. So it is great for arthritis. It's a very good especially for carpal tunnel syndrome and some of those joints. I do that all the time. And you can actually do this kind of movement back and forth. So this kind of 4 movement, flexion, extension, and circumrotation. And then you just move around opposite direction. So you do the clockwise, and then you do the anti-clockwise, you do the flexion, extension, and you do both sides, yeah? So this will be great for your proximal muscles. Do the same thing. I can show you my foot, but you can do the same thing with your foot. So the flexion, extension, circumrotation, okay? So do that every day. Do the same thing with the neck. Flexion, extension, right, left, and then you can do this, and then come back. And you can do everything. You can do the stretch. You can even sitting all day in the computer. You can just put one hand on your knee, the other hand goes at the back, and then look right all the way and try to look at the back so that your whole stretch comes from your belly. It's a great detoxification mechanism for your belly if you ate too much. and then go to the other side. And it's great for your bowel, great for your kidney, great for all the structures in the back. So it's really amazing. Parkinson's Disease Society now actually add yoga on their website. So if you have Parkinson's disease, they have yoga for Parkinson's disease. I actually teach specialized yoga for different diseases. So I disease like yoga for Parkinson's, yoga for anxiety disorder, yoga for movement disorder. So if somebody has MS, actually, if you go back to the MS website, they have yoga for MS. So yoga became a mainstream therapy. So especially in Stony Brook, most of our medical physician in every specialty do encourage our patients to do yoga and mindfulness, like meditation and things like that.
Right. We have one question and then I think we're going to be wrapping it up. Do sleeping pills affect glutamine storage of memory?
Say one more time, sleeping pill.
Do sleeping pills affect glutamine
So the
storage
sleeping,
of memory?
so the sleeping pill, depending on what kind of sleeping pill, yeah. If you are taking the proper sleeping pill, which does not have any effect like melatonin or proper prescription like trazodone, mirtazapine, that those are prescription sleeping pill. Those are not bad. Those are, you need that. You've got to sleep with that. I'm talking about sleeping pill that is mostly abused by, you can buy in the street like Xanax, Klonopin, Ativan, or the medication that you can buy over the counter like Benadryl, like sleeping pill. Those are not good because those can cause more confusion. Ambien can cause sleepwalking, so that's not good because it can destroy your normal sleep architecture if you take it. It's not okay. It's okay to take once in a while, but if you're taking it on every night, it kind of disrupts your normal circadian rhythm. And they had a big medical legal sue. I think you have probably heard a couple of years ago in New York State, there was a big lawsuit against the Ambien company that somebody was taking Ambien and all of a sudden woke up and went and drove and killed himself, because they were actually sleepwalking. So patient was driving when patient was in sleep. So they had no idea that they were. So this is dangerous. So the FDA has decreased the dose for Ambien for female no more than 5 milligram, and for man no more than 10 milligram. But I see a lot of patients take Ambien 15 milligram, like, oh my God, what are you doing? So these are not good medication. So if you really have a hard time sleeping, as I said, find out what is the cause of your sleep problem, and then treat the cause rather than treat the symptom.
Yes, very true. Thank you. I do want to mention that Dr. Absar and I discussed her coming back in the fall and doing a 2-part lecture series. No one knows about this yet, but we've been talking about it. And she's going to include yoga with it as part of the lecture. So that could be really, really engaging to get everybody up, or if they're sitting or what have you. So we're gonna, Dr. Absar and I, we're gonna continue our conversations about it, but I think it would be very useful for everybody. I mean, to have the yoga plus the lecture, then they can really see how it works. So I look forward to working with you on that.
Thank you. I will be very interested. Maybe that will be a little bit of movement and talk.
Yeah, no, I mean, clearly our members are very interested. Most of them stayed on for the whole thing, and it's something that's useful for everybody. We really appreciate this. This was great information. We thank you for coming.
Thank you.
And we look forward to seeing you again in the fall.
Thank you so much. Thank you.
And thank you all for joining.
Thank you.
Thank you.
Bye-bye.